So this is the second video of role of physiotherapy. Role of physiotherapy in ICU. So what are our major roles? So we are doing majorly three things in the ICU. One is the preventive management. Second one, restorative management. And the third one is a compensatory management. So for these three things, we need proper exercise prescription. That is also a major thing in the ICU management. So what are the preventive management? So we are teaching the exercise prevention for DVT, pressure ulcers. So prevention is better than cure. So we are teaching the exercises to prevent DVT and pressure ulcers. The second thing is the restorative, to maintain the muscle and joint properties, maintaining muscle length, range of motion, normal breathing pattern. So we are restoring inside the ICU so that we can mobilize the patient as early as possible. The third one is compensatory, mobilizing with support, assisted mobilization, breathing exercises with incendic spirometry. So with the assistive devices, we are mobilizing as well as we are teaching the breathing exercises also inside the ICU. If we want to achieve these three things, we need a proper exercise prescription. So that's also a major role of physiotherapist, to write an exercise prescription to achieve all these three. PT intervention. So we are giving early mobilization, chest physiotherapy, muscle retraining, and adjuncts using some modalities to support our treatment. Early mobilization, we are starting with the positioning bedside, physiological, therapeutic, and graded mobilization for pacing activities we are doing inside the ICU itself. And chest physiotherapy, basically to improve the ventilation and remove the secretions. We are giving chest physiotherapy, breathing exercises, postural drainage to remove the secretions, chest clapping vibration to mobilize the secretions, coughing and huffing techniques, forced expiratory technique to bring out the secretions with the respiratory passage, and suctioning. It's a mechanical secretion removal technique. So we check the contraindications before giving all these technique. If the patient is indicated for postural drainage, coughing techniques, we go for postural drainage, coughing techniques. Otherwise, we have alternative management. So mechanical secretion removal technique, suctioning. Patient who are unable to do active forced expiratory technique, or they are not advised to do forced expiratory technique, they can go for suctioning, mechanical secretion. The next one is muscle retraining. The peripheral, upper limb, lower limb muscles retraining, we're giving inside the ICU. Plus ventilatory muscles. We are strengthening upper limb, lower limb muscle for mobilization. The respiratory muscles strengthening to retrain muscles to improve the ventilatory pattern. And then finally, adjunct therapies. We are using the small devices for adjuncts, aerosol therapy, humidifications, CPAP, IBP. So all these adjunct therapies also helping for the physiotherapy management to mobilize, to humidify the secretions, to loosen the secretions, and to remove the secretions. To clear the mucus, we are using these adjunct therapies along with our physiotherapy. Cycle of PT program. So how to treat this patient? We have a cycle to give physiotherapy program. The first part is assessment. We have to take an assessment. Next step, we have to analyze the findings. Then we have to identify the problems. What are the problems? Which are the problem is. Then we have to plan for the treatment. Planning of treatment. Then we have to implement it. Implementation of the treatment. Finally, we have to do reassessment. It's a cycle. It starts from the assessment, end up with the reassessment. So the reassessment will give us the result, whether our treatment prescription was correct, whether the patient got the improvement or not. So we'll get to know through this reassessment. Thank you.